podiatry, our second case of the day today. We have a very young patient who presented to our office originally with these hammer-toe deformities of the fifth toes. As everyone can see, I'll give you guys a really great view. So the toe is not even purchasing the ground. Number one. Number two, the patient has a hammer-toe deformity. The toe is actually straight, believe it or not. What we're going to go ahead and do, this is extremely common. This is extremely common. And what we want to basically do is bring this toe down to the level where it belongs, right? Right now it's cocked up like that. We want to bring it down, number one. Procedure number one, bringing the toe down. Then procedure number two is to straighten the toe, right? Like that, right? Right now it's sort of like that. We want to go like that. That's going to be procedure number two. And procedure number three is we're going to just shave all the bone spur right here that's causing her discomfort. At the core, the problem is that the toe is completely cocked up. You can really appreciate it. I mean, it's really, really way up there. Take a look at the right one. Same thing. It's not, I can put my finger underneath the toe. So we're gonna bring, again, procedure number one, bring everything down. Procedure number two, release a little tendon underneath, and then we'll grind all this out completely and totally. And then that will eventually disappear. I even told the patient that, you know, the reason why even if she had the deformity, right? Even if she had the deformity and we only do the soft tissue procedures, which is basically bringing the toes down, this would disappear. Because the reason why she has these calluses is because the toe is rubbing against, right, the top of the shoe. So this is a wonderful case. We're gonna really make these toes, you know, look really, really beautiful. Stand by.
Hey everyone, so we're officially done with the procedure. We went ahead and I want you guys to take a look now. Let's take a look at the right one first. So I'm putting weight on this. We have one little suture, and there's one little suture underneath. And I want you guys to come from the front so you really see the difference of, you know, how the toes both dropped, right? That's the you know, that was the, see how they're now more in line. So we're going to go ahead and splint these down. And then this is, if anyone is wondering, well, the callus is still there. Yeah, but you see it's like a little balloon. It's a balloon. There's no bone there. Let's go to the left. Same thing, a little stitch, and a little stitch. And the same thing, you know, she still has the callus there. The callus will, you know, with time, the callus with time is going to basically disappear. Why? Because at the core, the bone spur or the bone is gone. And the shoes, right, will not irritate, okay, because the toes are definitely, you know, lower. So we're going to go ahead and, you know, for the next 3 to 4 weeks, we're going to go ahead and splint these little pinky toes down. That's the key, to make sure that they don't do this again. Because a lot of toes have a mind of their own, and that's sort of like the, you know, as funny as it sounds, it's 100% true. So what we want to do is, splinting is the key to the success, believe it or not, of these procedures. Make sure that they stay where we want them to, you know, in the position that we leave them in. So it's very, very important that we do that, okay? So everything looks great, very happy. You know, and we were just talking naturally, you know, there's some people that have these toes that just simply, I mean, the two toes on, the pinky toes have been, how old are you now? 31. Your toes have been like this for 31 years. The fact that they've never really touched the ground. So there's a certain level of, again, this is something maybe congenital that you were born with. But our goal is to eliminate the pain right here where the callus was, and that's key. So our goal is to make sure that doesn't, you know, recur. want the patients to be happy. Happy patient, happy doctor. How was your experience?
It was good. It was easy.
Okay.
Not any pain really. Just more pressure.
Okay.
I'm happy with it.
Super. The patient, we did give the patient a little something to sort of relax. She's very relaxed, I think. Everything sort of seems funny to her, even looking at me. So anyways, I will definitely keep everyone afloat on this patient's progress. We're going to go ahead and now splint. We're going to put some nice bandages and